Okay. Good afternoon everyone. Today I am going to be discuss sample collection and transportation. I am from Arun Kumar from Microbiology Department, tutor. Before going to the topic, we should know something about universal precautions. Without any universal precautions, we don't go for any other works, mostly in hospitals. Okay. And what are the universal precautions you should take while collecting samples? First one is use barrier protection. In case of any open wounds in your working area, please cover that open wounds by using some other materials like some sterile materials. Next, you should wear some gloves while handling body fluids or some other contaminated materials. Next, you should wear some face mask or gown. Without wearing any face mask or gown, you never take any sample. And use caution, because while handling sharp objects like needles and syringes or some other thing, okay, you should take some cautions because it should be taken some needles prick injury. Next, discard your contaminated materials by using biohazard procedures. Next, clean your area by using some soap and water. If soap and water is not available, then use disinfectant. Then disinfectant is not available, immediately call to respective fellow to come and clean the respective areas. Then wash your hand thoroughly with soap and water after your work is over. Then each and after everything is over, then wash your clothes by using hot water. Don't wash your clothes by using some chill water or ordinary water. Okay, before collecting sample, labeling is very important. Without proper labeling, you don't send any sample to microbiology department. Okay, and coming to labeling, patient name is very important. You should write patient name properly in bold letters. Don't write any joining letters. Then write clinical specimen. What type of clinical specimen? Whether it is a blood sample, whether it is an urine sample, whether it is a pus sample, whatever, you should mention clearly. Then what site, where you take sample, whether you take sample from left hand or right hand or left leg or right leg, whatever, you should mention properly. Then unique ID number. In hospital, each and every patient have unique ID number is there. Without any unique ID number, you don't send any sample to microbiology department. Then specimen type, it's a what type of specimen. Then date, time and place of collection. And name and initial of collector and ward, whether patient is ICU or OPD ward or operation theatre, whatever, it should be mentioned properly. Then coming to requisition form. It is very important. Without requisition form, don't send any sample to microbiology department. Based on patient clinical history only, we have to diagnose. We have to give accurate report. Okay. In that requisition form, you should fill all the information. Okay. This patient history is very important. Without patient history, don't send any sample to micro department. And signature of consultant. That is very important. And sign of the sample collector, who is going to be collect sample. And date and time, patient name, patient ID, age, sex, ward, sample or site, and test request, what test you want to perform. Okay, these are some criteria for rejecting samples. You should remember all those things while collecting samples and sending to microbiology department. Okay, first you should know mismatch of information on the label and the request. This is very important, because sometimes what happens in that container should be some other patient name and request should be some other patient name. Okay, this should be avoided. Next, inappropriate transport temperature. Sometimes in some blood sample you have to send 4 degrees Celsius. That time you are using some ice bag. In some samples at 37 degrees Celsius, you use by some other appropriate technique. In some sample using room temperature is no problem. You have to send sample by room temperature. Then excessive delay in transportation. You have to send all the sample within 2 hours. If going above 2 hours, we are not responsible. And inappropriate transport media. Suppose specimen received in fixative agent, or specimen should be in dry condition, or sample should be some questionable only. We don't know what type of sample. That everything should be rejected. And insufficient quantity. In CSF, okay, no problem. We have to take 0.5 to 1 ml. In urine sample, you don't send 0.5 to 1 ml. At least you send 5 ml of sample. Then leakage. That is very important. In case of any leakage, we never accept that sample. Then without any requisition form. See, by using this box, we transport a specimen. Then we move to one by one how to collect sample, then how to transport and how we have to preserve. First one is abscess. In abscess means there should be lesion, wound, pustules or ulcers. Okay, the abscess should be two types, aerobic and anaerobic. In aerobic means maybe superficial, anaerobic means it should be deep lesions. Okay, before collecting sample, we should wipe with sterile saline or alcohol the infected area. Then you have to take swabs, rub along the edge of the wound. After taking sample, you should be transported within 2 hours. And we require 2 swabs. If we send 1 swabs and we send after 3 hours, it should be rejected. In case of only 1 swab, okay, then you immediately call to microbiologist. You have to explain the condition of the patient. Then only we accept. Otherwise, we never accept any samples here. See here, based on patient history only we give reports. In case of post-operative patient, cons is significant. Without any patient history, how we give report? We have to give only no growth. Next, coming to pus. Okay, mostly pus should be aspirated by using syringes only. In case of closed space abscess, what happened? We should decontaminate skin by using sterile saline or alcohol, then insert needle and aspirate the pus, whatever sufficient amount you take, and send it to microbiology department. In case of open wound, remove superficial exudate, okay, aspirate through margin of the margin by using syringe, or if there is no pus, you can take swabs and you have to rub it and send it to microbiology department. See, this is an aspirated pus. And coming to blood sample. In blood sample, microbiology mostly using for culture only. And next thing is serology reactions. We detect antigen antibody reactions. And coming to culture, in our department, some blood culture bottle is available that is especially suitable for culturing bacteria only. Okay. In the blood culture bottle, we have 3 types of bottles available in our department. One is aerobic bottle, anaerobic bottle, and pediatric bottle. You come and ask microbiology department, we want aerobic bottle, we want an anaerobic bottle, pediatric bottle, whatever you want, you come and ask microbiology department, we will provide. In case of infant, you should take 0.5 to 2 ml. In case of children, you take 2 to 5 ml. In case of adult, you take 5 to 10 ml. Okay, this blood should be taken by vein puncture only. And coming to preparation of vein puncture, first you have to locate skin, you have to palpate where it's a vein, appropriate vein. Then use alcohol for 5 minutes, then dry for 30 to 60 seconds. Then take tincture of iodine, you have to apply to skin, again dry for 45 to 60 seconds. Then without palpating, okay, you have to take 20 ml of blood, and of this 20 ml, 10 ml you inoculate into aerobic bottle and 10 ml should be inoculated into anaerobic bottle. This is based on the patient condition only you have to take. In case of patient is very sick, then you take 5 ml. If in case of patient is an LT, then you take 20 ml. Then dispose of syringe in sharp container, label bottle and send it to laboratory. See, these are blood culture bottles. In case of febrile episode, you take two sets of blood. Okay, in case of bacterial endocarditis, you take 3 sets of blood culture bottles. Okay, don't take any 3 sets of blood within 24 hours. Then coming to body fluids. There are so many body fluids available. Okay, of this only few body fluids I mentioned here. Okay, one is amniotic fluid, ascitic fluid, bile, synovial fluid, pericardial fluid, pleural fluid and CSF. If you want to take any body fluids, same thing, first we apply disinfectant or sterile saline, then insert needle, then you have to aspirate how much amount you want. You want 5 to 10 ml, you take 5 to 10 ml. If you want 10 to 20 ml, you take 10 to 20 ml. How much amount you want, you take. Then immediately you transfer into sterile screw cap container. If this screw cap container is not available, then you directly inoculate into pediatric blood culture bottle system. Now label it properly and transport within 15 minutes. We send after 30 minutes, we are not responsible. We have to send sample again back to respective wards. See, this is sterile container, this is a needle aspirators. And coming to urine sample. Collection of urine sample should be very important because sometimes what happens, some cross contamination will take place. Okay, urine collection must be 3 types. First one is clean catch midstream urine, next one catheterized urine, third one is suprapubic aspiration urine. We see one by one. First one is clean catch midstream urine. Okay, it is very important because most of the time you are using clean catch midstream urine only. Okay, instruction to patient is very important. You give instruction to patient: clean periurethral area with soap and water, then inform to patient to pass initial urine into toilet, then collect midstream urine into sterile cup. Suppose the cup, the holding cup pass should be down, or you have to touch inside the cup. Okay, you have to inform immediately to respective nursing staff, tell them to take another new cup. Okay, before collection, label is important because urine collection, what happens, sometimes it should be spoiled entire container during passing urine. So you have to avoid all those things. You have to label all those things properly before collecting any samples. Okay, if we found more than 3 or 4 types of bacteria, okay, what happened, we send automatic report, it's a contamination, kindly send repeat sample. Okay, suppose in repeat sample also again 3 to 4 bacteria, then we give significant growth. See, this is a pictorial representation of how to collect urine sample. See, first clean your periurethral area soap and water, then pass initial urine into toilet, then you collect middle portion of the urine. Okay, then close it properly, then label it and send it to laboratory. Now coming to catheterized urine. Okay, it is very important. This is mostly useful for patient we having some underlying disease condition, or some children you have to use this catheterized urine. Okay, first you have to inform to clean the periurethral area with soap and water, then apply some spirit or some sterile saline to decontaminate, then insert catheter into bladder, then discard initial urine, then collect specimen into sterile cup. Okay, this is for normal catheter urine. In coming to chronic indwelling catheter, okay, in that what happened, you can take sample from junction between catheter and collection tube. Don't take any sample from this discarding bag. Okay, if you collect this collect urine from discarding bag, mostly from contaminations only, because it is 24-hour collection. What happened during 24 hours collection, mostly full and full contaminations only. So you don't collect any sample from this discarding bag, you should collect sample from this junction only. Then coming to suprapubic aspiration sample. This is mostly from some underlying disease condition only, mostly in pediatric patient. Okay, those who are unable to pass urine. Okay, what happened? You have to follow full aseptic condition because you have to insert needle into suprapubic region. Okay, it should be little risk. Inform to patient bladder should be filled before performing this procedure. Then pepper skin with alcohol or iodine. Then give some lidocaine for local anesthesia. Then insert needle to 0.2 ml, 0.2 centimeter above the symphysis. Then aspirate 20 ml of urine for culture. Then send it to laboratory. See, this is a procedure how to take urine by using suprapubic aspirations. Then coming to stool sample. Stool is generally non-sterile sample. Okay, before collecting stool sample, we should know something about stool. Okay, what is a normal flora of alimentary canal? Then only we give reports. Without knowing alimentary canal normal flora, we never give any reports. Okay, freshly passed stool sample is very important. Avoid specimen from bedpan. Bedpan is not a suitable specimen for culturing stool sample. Use sterile or clean container. Okay, don't use any container with disinfectant. During outbreak, you should collect 10 to 20% stool samples. And coming to collection, we take clean leak-proof container. In case of liquid, you take 1 tablespoon, that is 5 ml of stool sample. In case of formed stool, you take pea-size stool is sufficient. Then after collecting, you transport within 30 minutes. If delay, transfer fecal sample into transport media. Don't send any sample with preservative or some fixatives. If you send any samples in preservatives or fixatives, it is not suitable for direct wet-bound examination, Glycerin difficile toxin reduction, reduction of viruses, ELISA and lattice agglutination tests. And coming to bacterial culture. mostly we encounter Salmonella, Shigella and Campylobacter. If doctor asking, if specifying, we want Vibrio, we want Aeromonas report, we want Pseudomonas, Yersinia, E. coli O157H7, then that time only you have to process, otherwise we never process this thing. Suppose if doctor asking Shiga toxin assay, then you follow, otherwise you don't follow any Shiga toxin assay. Okay, this everything should be recommended by CDC, Center for Disease Control. Suppose some people giving report E. coli, in that time you go and confirm with doctors what is a patient condition. Then when we give report as an E. coli as significant, and don't give any gram positive bacilli or gram positive cocci. And coming to stool for parasites, okay, you have to take 3 parts of stool sample to 1 part of preservative, mostly using preservative here 10% formalin or polyvinyl chloride. Okay, this unpreserved sample for antigen detection and PCR. This preserved sample is not suitable for PCR and antigen detection. And coming to rectal swab, this is mostly suitable for small children and debilitated patient and other situations such as those who are unable to take out from the bed. That time you have to take this rectal swab. Coming to collection, insert swab approximately 2.5 cm anal sphincter and figures should be visible on the swabs. Then you have to take out immediately and transport immediately without any delay. If delay, use transport media. It is not suitable for parasite detection, toxic detection and viral agents. It should be only for cultures only, bacterial culture only. And coming to drawback, there is no macroscopy assessment possible and less material available and not recommended for viruses. And coming to gastric aspirate, the gastric content mostly used for TB detection. Mostly what happened, some young children have difficulty to exporting sputum sample. So that time what happened, we have to recommend gastric aspirate, because what happened, gastric aspirate when children with pneumonia sleep, what happened during mucociliary mechanism, okay, the entire mucus sample what happened comes into the upper respiratory tract, then reaches into throat region, again the swallowing the children, then what happened is enters into stomach region. Okay, that is during stomach region what happened, it contains rich source of TB organisms. And coming to collection, before collection, instruction is very important. You have to give instruction to patient who come early morning and inform to patient you should sleep at least 6 hours before collection. Okay, and inform to patient should not eat or drink anything overnight to prevent the stomach from emptying. And come to collection by using nasogastric tube. Okay, don't use any surgical loop because it is an bacteriostatic, it will kill all bacteria. And mostly we give report going for negative only. Use large bore nasogastric tube, don't use small size tubes. Okay, and avoid too deep, because what happens if we enter too deep, it enters into phylorous region. Okay, what happens, it will take whatever contents into phylorous region and you have to take from outside. So it giving some false positive or false negative report during processing. Should be 2 samples required for processing, 1 on each day. Suppose if it is not possible, inform to respective microbiologist and inform. Patient condition is very difficult, so it is not possible to take 2 samples, 1 is sufficient. After taking sample, you have to transfer 5 to 10 ml gastric fluid from syringe into sterile container, then add equal volume of sodium bicarbonate solution. Because what happened, acidic, we have to take in sample from gastric content. In gastric content what happened, because it increasing in pH, increasing acidic pH. So we neutralize this acidic pH by adding sodium bicarbonate solution to prevent the destruction of tubercle bacilli. And coming to sputum sample is mostly taken by using 2 methods. One is induced sputum, next one is exported sputum. And coming to exported sputum, it is very important. Most of the time we have coming to our laboratory this sputum only. And this is a very risky also, because most of the time patient will contaminate with saliva also. So it requires some invasive technique and what happened, some good knowledge about patient and nurses. Then only we getting this good sputum. And coming to collection, before collection you should be informed to patient, don't take any food 1 to 2 hours before taking any sample. Okay, mouth should be rinsed with soap, saline or water, and should instruct to patient to provide deep cough, okay, and open the container and keep it near to the mouth. Okay, what happened during deep cough? What happened? Sputum actually come in contact with wide mouth sterile container. Then immediately close the tube and mark it properly and send it to laboratory. Minimize, avoid saliva contamination. Suppose if you have any saliva contamination, it's not suitable for microbiology laboratory. We send it back to respective wards. See, these are common procedure. Clean your mouth and breathe in and out 3 times. Then take a sample. Then coming to acceptance and rejection criteria for sputum sample. Suppose if sample is sending to microbiology laboratory as a more salivary. In microscopy, you have to find out more than 10 squamous epithelial cell. It is rejected. Okay. In coming to excellent sample, it should be more than 25 polymorphonuclear cells plus few epithelial cells. That is 5 to 6 cells. It is excellent. Suppose if you find out more than 10 squamous epithelial cell on 1 or 2 pus cells, it is not suitable for culture. It may be some salivary contaminations. Okay. And coming to induced sputum. Okay. It is mostly suitable for patient unable to produce sputum sample, because mostly in sick patient only. It is difficult to induce sputum. Okay. But in that time by using some special technique to take sputum sample. Okay. Before collection, patient should be brushed the buccal mucosa, tongue and gums, and to give the patient some nebulized hypotonic solution. What happens? This solution, it liquefy the airway secretion and promote the coughing and allowing sputum secretion to outside. And coming to contraindication and precautions while collecting samples, because induced sputum we giving hypotonic solutions only. What happens if we are giving hypotonic saline solution? It causes bronchoconstriction. Due to this bronchoconstriction, what happens? Patient is going to be some critical stage. Okay, before giving this hypotonic saline solution in case of asthma patient or some suspected asthma patient or severe lung impairment function patient, you have to give some medical pre-medication. Then only we give this sterile solution. Otherwise, you never give any sterile solution. Then apart from this, in case of severe coughing patient, don't perform this procedure. Okay. And apart from this, patient who have hematopsis, acute respiratory distress, unstable cardiovascular status, thorax and abdominal or cerebral infections and hypoxia, lung function impairment, pneumothorax, pulmonary emboli. These are conditions we never use this technique. We go for exported sputum technique only. And coming to ET secretion, endotracheal secretion. Okay, it mostly by use tracheostomy patient only. What happened by using Lucan trap? You can take sample. Okay, what happened mostly tracheostomy patient, mostly GNR present in this mouth region, and apart from this tracheostomy equipments. Okay, it is not clinically relevant. Okay, sometimes what happened, it will enter into lungs and cause pneumonia during aspiration. Okay, we have to confirm the patient history, and based on the semi-quantity report, we have to correlate and give based on the semi-quantity culture report and clinical condition of the patient. Then only we have to give clinic. It is significant. Otherwise, you never give. It is not significant. And coming to nasopharyngeal aspirate. Okay, this is also one of the respiratory secretions. What happened? Attach mucus strap into suction outlet, because see, this is some suction tube. Okay, we have to attach inlet and outlet. Okay, in outlet, what happened? You insert into nasopharyngeal region. In outlet, we should connect into some suction pressure. Okay, with help of gentle suction, what happened? It will take all the mucus sample from upper respiratory tract into this Lucan strap, this tube. Then after taking this thing, you have to cut this tube and immediately transport into laboratory. You have to transport within 15 minutes. If taken more than 30 minutes, what happened? It should be contamination only. So that time we have to reject sample. So you should take care while transporting sample also. you have to place the sample in ice box or in refrigerator if transport is delayed. And coming to nasopharyngeal aspirate, nasopharyngeal swabs. Okay, inform to patient, sit comfortably in chair or some other stool, then tilt head backwards and insert flexible fine shaped polyester swabs. Don't use any cotton swabs. Okay, if you use cotton swabs in case of anaerobic, we give some wrong reports. Use some polyester swabs into nostrils and back to the nasopharynx. Leave it for few seconds and withdraw slowly by using gentle rotation. And coming to ear sample. In ear sample, in case of inner ear sample, you have to clean inner ear with soap and water before puncturing hair drum. Okay, then after washing, you have to puncture aspirate material. Okay, then in case of there is no pus, then you have to take swabs and you have to gentle rotate and send it to laboratory. In case of outer ear, you have to take sterile cotton swabs. It should be moistened with saline or some transport media, and you have to wipe the crust with sterile saline only. Then you have to gently rotate the swab in the outer canal. Then you take gently outside, then transport into laboratory immediately. And coming to eye samples, mostly using conjunctival swabs, vitreous fluids or corneal scraping only. This will require some full aseptic conditions and full precautions. Without using any precaution, don't take any eye samples. Those who expertise that person only taking these samples. Okay. After taking this sample, transport within 15 minutes to laboratory. If you delay, don't send any sample to laboratory. Otherwise, you keep it in refrigerator. Then you send sample after 30 minutes to 1 hour. Whatever, but before 1 hour, you send sample to laboratory. If you have any clarification, okay, see this website. Okay, in this website I have 149 videos regarding about sample collection and lab management system. Okay, if you have further any doubts, come and ask me in department. Thank you.